Namaste and welcome to Taiyaari Sabke Sath, a series of inclusive conversations on building disaster preparedness with communities where persons with disabilities are not an afterthought but at the center. In India, when crises like pandemics, floods, or cyclones strike, people with disabilities and those with long term health conditions often face layered risks. The Taiyaari Sabke Sath series is anchored by ASTHA, a Delhi based organization working for over 33 years to promote disability rights and inclusion in low income urban communities. Our conversations lead up to the launch of two upcoming studies that explore how community based rehabilitation and community based inclusive development supported people with disabilities during the COVID 19 crisis and other overlapping disasters. The research features five grassroots organizations: ASTHA in Delhi, Jan Swasthya Sahyog in Chhattisgarh, Ishwar Sankalpa in Kolkata, Sadhana in Odisha, and Sanchar in West Bengal. The two reports are going to launch on 7th July in Kolkata and 15th July in Delhi. A third report featuring Astha, Sadhana, and Sanchar will follow very soon. So stay tuned. So, to discuss the conversation and know more about these studies, today I'm joined by Sarbani Das Roy from Ishwar Sankalpa, who has led this important research and study in the state of Kolkata. Hello, ma'am. Welcome.
Hello. Thank you so much.
So, Sarbani, ma'am, Ishwar Sankalpa's approach to mental health support is deeply rooted in community. And the reports that I studied were really enlightening. And the challenges that many of our traditional ideas of who can care is something that came very beautifully in the report. So, ma'am, can you just briefly tell us how Ishwar Sankalpa actually began and what led you to adopt the idea of everyday community members like tea vendors and shopkeepers become caregivers and allies in this recovery process during the crisis?
So what happened was Isha Shankalpa began with it just happened. Isha Shankalpa happened because one day two of the founder members, Dr. K.L. Narayanan and myself, we were walking on the streets of Kolkata and we saw this man eating from a garbage van. And we realized that this was a man, just opposite that vat was a kind of missionaries of charity where they gave out food every day, and we realized that food was not reaching this man because of the symptoms of his illness. He could not be accepting food. And another possibility was that people were not coming to him with the food because most people are afraid of the mentally unwell. They think they could be dangerous, they could hit out, and they are all violent. So these are some of the myths which surround mental illness. And so people who are on the streets, homeless, as well as with psychosocial disability, are the most neglected, invisible population that you can find anywhere in the world. So, what we decided was that if there was something that we had to do, we had to reach out to these people. Because, as Dr. Narayanan said, this person would probably die in another 15 days, not due to anything else, but due to dehydration. And this is something which is unthinkable at this day and age. And that is when we decided in Ishya Shankalpa, we took a resolution to make a change in the lives of the last persons on the street, people with psychosocial disability and homeless.
Wow, this was such a heartbreaking, but at the same time, so insightful. Often we really neglect, we don't think about such allies or, sources around us. And I'm so happy that we actually thought of building those allies and communities and strengthen them. But, ma'am, when we think of the lockdown, during the lockdown, I remember Bengal was also hit by Cyclone Amphan. It was a crisis on the top of a crisis, right? So, what was it like for people with psychosocial disabilities living on the streets that time? And what barriers did they face, especially the women?
So, when we started our work, the organization did not have enough money which turned to be the blessing, to form shelters or to form institutions where we could keep such people. So we looked outwards and went out to see what are the resources that the community can give us to take care of people who are homeless on the streets and with mental illness. And we found that it could be the nearest chaiwala who is sitting near a person with homeless and mental illness, who would anyway be giving out tea to this person every day. We just turned that person, we requested that person, would you help this person, give him his daily medication, and give him a little bit of friendship and care, so that he can, there can be a change in him. And that is what exactly happened. And slowly we saw that the owners of this recovery, because this was not only a clinical recovery, this was also social recovery, because slowly he became better. Slowly the chaiwala started bringing food from his own home for this man who has now become his friend. So these relationships all over Kolkata started to build a community of care, where people started to look at people with mental illness on the streets of Kolkata a little differently. And once this ecosystem started evolving, it sort of, it just, blossomed. And we had many people coming forward to take care of such people on the streets. But they were necessarily street dwellers or people living off the street shops, So it could be small shop owners, it could be vendors, it could be chaiwalas, small time businesses. But everyone had a wish to serve. Everyone wanted to give to society. And that is what I talk about, equity in philanthropy. And so as this system developed, then came the big test for this system. That was the COVID and the Amphan. Because when COVID happened, the entire world closed its doors. They stayed inside. But when they closed their doors, the only persons who did not have doors were the people on the streets. They had nowhere to go to, nor was anyone willing to let them inside their homes. So where would they go? They were just out there on the streets. But at the same time, we saw that the relationships which had been building over years, over time, with this proxy family of caregivers, those strengthened during the COVID-19. What we saw was these caregivers, sometimes we see even families forget each other when, they are distant. But the caregivers did not forget the people with whom they were connected. They somehow made some effort to reach out to them, to bring them food, to give them some kind of support. And this is how humanity raised its head, even when the whole world was actually just trying to save their own. So this was a wow moment for us, because we saw that, the work that we had done over time, over say even, 10, 12, 15 years, it had actually built, you know, uh, relationships of trust,
Right.
compassion between utmost strangers. And this is what helped people to rise again. And we've seen it's not only people from Ishwar Sankalpa, the staff from Ishwar Sankalpa, it was the people from the community who actually stood by them. During the Amphan, during when water was rising and trees had just fallen on the street, the caregivers would actually call us, Didi, I can't reach that place. Could you just see if, that this person, Bhola, is safe or not? So, that concern we can never forget. So, this is what humanity is all about. This is what Kolkata is all about.
God, as you were talking, it was so touching. Frankly speaking, when I was also going through the report and the study, it really touched me because some of the words and the narratives that I read were heartbreaking, but at the same time, I don't know, for me as a reader, it was very rewarding also to read that. So, ma'am, as we look ahead, uh, it's important to think about not what just went wrong, but also to build something, the need to build better. So, what do we need to build or strengthen further to ensure that people with psychosocial disabilities are better supported during times of crisis?
So, during times of crisis, I think temporary shelters with some amenities are needed. So it's not always that, people, especially when our teams can't reach a certain place, then it becomes very vulnerable. So having small temporary shelters where they are not restrained, but where they can seek refuge in times of, distress, that is what is needed. Systems, I mean, I wouldn't say nothing was in place because, at that point of time, the Kolkata Corporation, the police also looked out for the people and they did take care for them. But we need a little more structured, systematic support for people with psychosocial disability because just taking them over and putting them in a temporary space is not enough. They also need a bit of medical support. They need some kind of there are some people with comorbid problems. They need support for that. So the hospital needs to give access to such issues, when people come and distress happens. And these are some of the things, if they are put in place, I think it's enough. Food is not an issue. Food is plenty, and in Kolkata, people do get food, but it's the other things, it's the care, it's the
Yes.
looking out for a person, it's the relating with a person to give a little bit of time, a little bit of concern. That is what, makes it's not only the homeless people, it's for all
Yes.
of us. And I think one thing, Anjali, I would like to say this with a kind of conviction that COVID-19 actually exposed that we are all marginalized, we are all very
Absolutely.
vulnerable, and it is not only people with who are homeless with psychosocial disability, but I think it was a great equalizer, and I could feel what this person on the street was feeling. I could feel the same when I was at home. So it's the marginalization was, I think, a full circle. Yeah.
Absolutely. I couldn't agree more, ma'am. Even for me, as somebody who was living in Pune at that point of time, of course, I live with multiple sclerosis, but for me, that was, anyways, a food for thought as to how even the marginalized communities must be dealing with before even the COVID time. So I think it also was a reality check for most of us, and it actually taught us the value of empathy and humanity at the same time. This was really an
Yes.
amazing conversation, ma'am. I'm so glad that we had a talk on this. Thank you so much for joining us, and all the
Thank
viewers
you.
out there. Please join us on the launch of the two important and mind blowing reports on 7th and 14th of July in Delhi and Kolkata. Thank you.